The riotous rift between hardcore Trump supporters and those backing impeachment shatters the tradition of cooperation among San Diego's congressional delegation. The pandemic surge continues to tax San Diego health systems. Some restaurant owners buck restrictions, but there's hope for older residents. And the situation remains dire in Imperial County as vaccinations are merely trickling into the region suffering California's highest rate of COVID-19 hospitalizations. I'm Mark Sauer, and the KPBS Roundtable starts now. Welcome to our discussion of the week's top stories. I'm Mark Sauer, and joining me on this remote version of the Roundtable, columnist Michael Smolens of the San Diego Union Tribune, Jonathan Wosen, who covers biotech for the Union Tribune, and iNewsSource reporter Jennifer Bowman. It was called the Red Mirage. Early vote tallies in the half-dozen closely contested states favored President Donald Trump. He had told his supporters to vote in person on November 3rd, knowing those votes are counted quickly. Later returns favored Joe Biden because they reflected ballots mailed in or dropped off, which take longer to count. To declare a winner in close races before all votes were counted was irresponsible, even dangerous. But that's what Trump did at 4 a.m. on November 4th. That action, telegraphed for months, set up Trump's big lie about how the election was, quote, rigged, that Biden's clear victory was a fraud. The big lie caused an angry rift among Americans within the House of Representatives and among the 5-member San Diego congressional delegation. Michael Smolens, columnist for the San Diego Union Tribune, joins me now. Michael, welcome back to the Roundtable.
Talking to you again, Mark.
Now, you wrote this week that though members of opposing parties, San Diego's congressional representatives have had a long reputation for working together on important issues like those involving water and cross-border sewage and commerce. But now Republican Darrell Issa strongly supports Trump's baseless claims about the election fraud, and the 4 Democrats just voted to impeach the president. It looks like the era of cooperation is over.
Well, we'll have to see. Feelings are pretty raw right now, and there's been a lot of changes in the delegation. We have a very new member who was just elected last year, Sarah Jacobs, and Mike Levin, who was elected in 2018, actually took over Issa's district. Issa was in hot political water and decided just not to run for re-election. So there's a lot of dynamics. But I think what's happening here, it's different than just a tough presidential election. I mean, these people are on different sides of issues all the time. But historically, as you mentioned, they've come together for local issues, and delegations before them. That's been sort of the San Diego way, and there's been a collegiality of it. That's got to be a little tough to get back. Will they ultimately come together for big things in San Diego? Probably. It's going to be in their best interest for re-election, for one thing. But the relations are going to be a little bit dicey for a bit.
And remind us what San Diego Democrats, that'd be Scott Peters and Jacobs and Levin, who you mentioned, along with Juan Vargas. What have they said this past week following the deadly insurrection at the Capitol?
Well, they said Trump was responsible. They quickly came out to endorse, both invoking the 25th Amendment to have Mike Pence and the cabinet remove him, and if not that, impeachment. Sarah Jacobs, she was sworn in on a Sunday, and like 3 days later, she came out very quickly to call for impeachment. They called this an assault on democracy. I think Scott Peters used the term a coup. They didn't sugarcoat it. While Darrell Issa, even as of today, posted a statement, basically calling this all a political gambit by the Democrats, rather, that they've been trying to get him for 4 years, and this had nothing to do with what happened at the Capitol, which is a pretty remarkable statement.
Now, Issa is among Republicans calling Democrats hypocrites for not condemning vandalism and fires set during some BLM protests last year, even though they called protests to be peaceful. Now, those protests stem from the actual killing of blacks by police. The insurrection at the Capitol, for which Trump was just impeached, was based on the president's big lie. How do Republicans like Issa get away with that?
Well, because people believe what they want to believe. We're in this era of alternate realities, of alternate facts, so to speak. And that's what they're appealing to. I mean, do they get away with it with everybody? Obviously not. But the core Republican supporters, they do. Now, having said that, there's certainly something to be said about some of the violence that was associated with some of the Black Lives Matter protests and the people that committed it. The protests were largely peaceful. Most people went there for the reasons you said, to protest basically needless deaths of Black people at the hands of police. So, the motivation is different as what's happened here. That's not to excuse violence in any regard. And, maybe some Democrats weren't quick enough to speak out about that. But it just seemed to be an odd time to be bringing that up months later at the time where the Capitol was almost taken over.
Now, it's one thing to not have a collegial working relationship, but quite another to suspect some of ICE's colleagues that they collaborated with members of the mob. And we're seeing reports about that this week. How does that rift ever heal?
Boy, that's a good question, Mark. I guess, every day it seems like we see details, more videos that are just horrifying about what happened to, at the Capitol to poor, police officers. But yeah, the fact that there was, inside coordination on this, not only in the run up to it, but, there's reporting that the day before some members might have been, giving tours, and one Democratic member called it reconnaissance to people that were involved in these in the assault on the Capitol. So there's going to be a lot to sort out, and I think that's directly responsible for Speaker Nancy Pelosi putting in the metal detectors at the door of the House chambers. You've got some people that are QAnon followers and very conservative people that talk about carrying guns. Some have openly talked about wanting to carry guns on the floor of the House. And the notion that some of these people may have helped this assault that was in some quarters, aimed at harming members of Congress, people are very concerned about their safety there.
Now, what if ICE were to declare now that the election was fair, that Biden won, Trump lost, it's time to work with the new administration? What impact might that have within ICE's conservative district and across the nation, given his long service as a Republican in Congress?
I think he'll get there. He's been trying to kind of thread the needle a little bit. He said that he's going to be at the inaugural on Wednesday, and he hasn't full-throatedly said Trump lost and Biden was legitimately elected, but he's moving in that direction. I don't think that's going to hurt him in his district. I think that he will ultimately he's going to go to the inauguration. He's acknowledging that Joe Biden is going to be the next president. It's a very conservative Republican district, but I don't think that what he's doing and his approach will hurt him with that district. But again, he hasn't been really open about Biden being the winner.
Now, finally, as he was being impeached, Trump this week issued a video denouncing violent protests generally. But he notably has not conceded. He hasn't backed off his claims the election was stolen, hasn't even expressed remorse for the deaths and injuries that occurred in a riot following his Stop the Steal rally speech. Does there come a time when ISA and those refusing to certify Biden's election finally disavow Trump, or is this kind of a new lost cause caucus going forward?
Well, I think what the issue is that Trump is still going to be pretty influential among the Republicans. I mean, he's got a core, fanatical following that's very large, and a lot of people don't want to alienate those folks. So, in a pure political sense, and I'm not one to show a lot of sympathy here, but they're sort of in a tough spot. A lot has been written that, for the Republicans, and many want to divorce themselves from Trump, that he's just going to be a problem for them if he sticks around and is influential. For them to distance from Trump, they really should have voted for impeachment, that would have totally marginalized him. Well, maybe, but we've seen in the past that Trump has survived certain political death that would have knocked down more traditional politicians, and he survived, if not thrived. So I think that they view that as a very risky thing, which is why a lot of people didn't do that. They would run into primary challenges based on voting to impeach Trump and so forth. So I think that as if Trump's influence wanes and his profile wanes, you'll see more people distancing them from him. But I think in the meantime, they're very leery of the power of his supporters in their future.
We'll see how it all plays out soon enough. I've been speaking with Union Tribune columnist Michael Smolens. Thanks, Michael.
Thanks, Mark.
As COVID cases stemming from holiday gatherings work through the San Diego hospital system, enforcement of restrictions at public places is being beefed up. There's good news for people 65 and older, but a distressing report from the safari park. Here to explain it all is Jonathan Wosen, who covers biotech for the San Diego Union-Tribune. Well, COVID continues to dominate headlines. Jonathan, let's start with vaccinations. Big news this week for those of us 65 and older. We can now get vaccinated for COVID. The trouble is availability. What's going on there?
Well, basically what just happened is that the number of people who can get vaccinated has doubled, but the actual amount of vaccine in the county has not. So, we heard the state government and the federal government this week say that people 65 and up can now get vaccinated. And then we heard the county say during their Wednesday briefing, basically, well, if you can get a vaccine through your healthcare provider, yes, you can get vaccinated. But the county doesn't plan to actually begin immunizing people 65 and up until maybe the week of January 25th. So a couple of weeks from now. And it basically comes down to supply and demand. So up until now in San Diego, we've been focusing on vaccinating healthcare workers and people in nursing homes. And collectively, that's a group of about 620,000 people. And there already wasn't enough vaccine for everybody in that group. So now you're tacking on, nearly almost 500,000 more people, older adults in the county who on paper are eligible to get vaccine if they can get access to it.
And I know you'll be reporting on President-elect Joe Biden's big push for emergency manufacturing and a big push for vaccines nationwide. We'll see how that all plays out. Now, the county opened a big drive-through site near Petco Park downtown. How's that working out so far?
So far, it seems to be working relatively well. This is what the county is calling their vaccine superstation that they launched on Monday in partnership with UC San Diego and San Diego Padres out in the tailgate parking lot by Petco Park. And so this is a vaccination site for healthcare workers who don't otherwise have access to a vaccine, maybe because they don't work for one of the big hospital systems in town. Spoke with a couple of healthcare workers who had just gotten their shots and said that within about a half hour, they were able to get in and out of there. So for the most part, things have gone pretty well. And we know that the county has said that they want to have 3 more massive vaccine sites like this one, including possibly one in the South Bay starting in February. So this has basically become a sort of test case for whether or not the region can smoothly run and operate these mass vaccine sites that we'll need more of in the months ahead.
Now, give us an update on the COVID-19 numbers in San Diego County. We're seeing the surge continue as expected post-holiday, right?
Yeah, it's almost become like clockwork in the sense that each time there's a holiday, we've come to see that, about a week or so later, you'll see cases go up. A little bit later, you'll see hospitalizations go up. And usually the last thing will often be a bit of a bump in the number of people who are dying of COVID-19. Around the start of the new year, we saw what at the time was record number of cases, well over 4,000. Since then, we've been seeing 3,000 to 4,000 new cases reported a day, and it used to be that 2,000 was a big deal. So we're seeing things generally go up and up. We're seeing the percentage of tests that come back positive for the coronavirus also going up. So that gives you a sense that we're not just finding more cases because we're doing more testing, and we are doing more testing, but that there's a real increase, growth in the pandemic in San Diego. That's something that makes it hard to do contact tracing. So if you want to figure out all of the people that person who tested positive spent time with, so you can make sure they get tested or they go into quarantine, it's hard to do that when you're getting thousands of cases a day. So we're definitely seeing, as we've come to expect, unfortunately, cases continuing to be high here.
Now, let's turn to restrictions on public gatherings. Your stories this week noted the continued tension between some business owners and health officials. There's defiance by some restaurant owners, causing officials to respond with more enforcement. What's going on there?
Right. So, one of the issues throughout the pandemic has been, how well can the county actually enforce any of the public health guidelines that it's put in place? And, it also puts businesses in the tough position of closing, reopening, closing, and reopening. And, that's continued to be a kind of a source of tension there. So, we know the Board of Supervisors voted this week for a more proactive approach to enforcement. They've hired, I think, about 17 more staff to actually begin looking for violations rather than waiting for the public to file complaints. If, for example, a restaurant is continuing to have people come in for indoor or outdoor dining, or a gym is still up and running. So they're adding 17 more people and saying that their posture is going to be a little more proactive. I think we'll have to see how that plays out.
And finally, you reported the troubling news about gorillas at the San Diego Safari Park east of Escondido. What did animal keepers discover out there this week?
Well, they discovered that gorillas can get COVID, which is something that had never been conclusively shown until this week. Basically, what happened about a week ago was that one of the zookeepers at the San Diego Zoo Safari Park tested positive for the coronavirus. This is somebody who had no symptoms but was still infected. So at that point, the Safari Park team started monitoring the gorilla troop. So there are 8 gorillas at the Safari Park. And, they noticed that a couple of them started coughing, seemed a little more lethargic, were breathing a little differently, were huffing a little bit. Some of the same symptoms actually that you might expect if, from a human with COVID. So they did a COVID test on fecal samples last Friday, got back an initial positive result, and then confirmed that on Monday morning. So this is the first example we know of gorillas, orangutans, chimpanzees testing positive for this virus. For the moment, they're just going to be monitoring the gorillas and essentially hoping that they recover on their own as long as they're eating and drinking enough. They have been talking with physicians in San Diego who treat human cases of COVID to look at those treatment options. But for the moment, they're just keeping a close eye on the situation and seeing what happens there.
Well, we'll hope for their sake and for our sake that this pandemic surge starts to flatten out and the numbers start getting a lot better a lot sooner. I've been speaking with Jonathan Wosen, who covers biotech for the San Diego Union-Tribune. Thanks, Jonathan.
Thank you.
Much has been written about the COVID-19 surge in Southern California, but one place that's been heavily hit throughout the pandemic is Imperial County. These are mostly farming communities tucked next to the borders with Mexico and Arizona. Like their larger neighbors to the west, Imperial County is also struggling with a recent surge in cases and not nearly enough vaccines. iNewsSource reporter Jennifer Bowman has been following the situation out there and joins us for an update. Hello, Jennifer.
Hello, Mark. Thanks for having me.
Well, set the scene for us. How's the vaccine rollout going so far, and how does the supply fall short in Imperial County?
Well, like you said, what Imperial County is experiencing isn't unique. Officials there are kind of battling the same thing that we're seeing here in San Diego County. The demand exceeds supply. Imperial County has received about 6,200 doses of the vaccine so far, and that includes both the first and second rounds, the second doses. And that doesn't cover everyone who's currently eligible for the vaccine there under this first phase that we're seeing right now. And it certainly doesn't cover the demand now that the state is opening it to those 65 and over to get vaccinated. So the county says they're working hard to get more vaccines, but they're acknowledging that they believe the limited supply will continue.
Now, President-elect, soon-to-be President Joe Biden is talking this week about an emergency order immediately focusing on vaccines, beefing up manufacturing. Is there hope out there that that help will quickly come, at least on the vaccine front?
Imperial County, they did get some good news this week. Actually, the county wasn't expecting to see any more shipments this week. And they actually received word a couple days ago that they have another 500 doses coming. But as officials say, they're advocating for more vaccine. They're working with the hospitals. They're working to coordinate this, and they're certainly in favor of more. But as they're planning right now, they're really planning for that supply to be limited and for them to have to prioritize in the way that they are right now.
Yeah, we'll all have to see what happens in the weeks to come. Now, healthcare workers are among the first to get the vaccine, but there's a priority list even among them. How does Imperial County decide the pecking order?
Yeah, so workers in certain healthcare settings and residents in long-term care facilities like nursing homes right now are eligible to get the vaccine under the state's guidelines. But the county knew ahead of time that the supply was going to be limited, so they had to prioritize. They did a baseline assessment of those healthcare facilities to determine, which of the workers were at high risk or the highest risk. So frontline clinical staff, respiratory therapists, the emergency department staff, ICU, those caring for patients with COVID, that's who the county put at the front of the line. And so what we're seeing right now in Imperial County is most of those vaccinated so far work at the 2 hospitals in the county.
And of course, most deaths here and across the nation are among the oldest among our citizens, and residents in nursing facilities are getting the vaccine first. How are pharmacies helping out with that?
Yeah, this is welcome news, I think, in Imperial County. The county has 3 skilled nursing facilities, which saw severe outbreaks and deaths during the pandemic. And so 2 of those 3 skilled nursing facilities are set to begin on-site vaccinations this week. One of them started Tuesday, and that's part of the federal program known as the Pharmacy Partnership for Long-Term Care. Walgreens and CVS, some other pharmacies, they're handling the entire process at these on-site vaccinations. They're doing the storage, administering the shots, handling any reporting requirements they may need after. So I think it's welcome for facilities that have been hit pretty hard in Imperial County.
And you report that Imperial County had the highest hospitalization rate in the state this week. How are the hospitals coping there several months into the crisis? We've had stories, and you've reported about having to ship patients out of Imperial County to San Diego, as far north as the Bay Area. What's happening now?
Yeah, I think, the impact on these hospitals in Imperial County, I think really show how dire it has been there during the pandemic. Imperial County had the highest hospitalization rate earlier this week. That's a statistic that we see change a lot, especially for Imperial County because of its small population, but it's almost always in the top ranking. So these hospitals have been badly hurt. The El Centro Hospital, just to give you kind of an example, they have 161 licensed beds. Last month, the number of just COVID-19 patients reached 131. And in total, that was the most patients the hospital had ever seen in at least 20 years. And so they've learned some lessons to help them. They had this second wave in the fall. We saw additional beds arrive. We saw a 50-bed tent, for example, set up in the parking lot of the El Centro Hospital. They reopened an alternative care site that was stationed at the community college there. But they've struggled to deal with that caseload because, you need staff to help the people who are in the beds. So they've gotten help from the state in that way, and they're now starting to see the numbers go down slightly. But they haven't had to do those major patient transfers that we saw early in the pandemic. And
San Diego's getting slammed. You wonder if they did have to do some transfers, if we even have the room over here now.
Yeah, so the county, Imperial County officials said last week that a few patients were sent to the field hospital at Palomar in Escondido. And I think when that opened, that came at a critical time because Imperial County was seeing their numbers, their caseload just skyrocket at the time. But this is a lot different, I think, than the first wave because, the hospital leaders tell me that they acted proactively in getting a lot of these set up to increase capacity ahead of time.
And frontline workers are exhausted. CNN reported on turnover at a hospital near LA this week, staff deciding to quit because it's become too much. You heard anything about the morale among workers in Imperial County? How are they dealing with it?
I don't think it's a surprise to anyone when I say that they just seem very tired. The head of the El Centro Hospital, Adolf Edward, he tends to be very optimistic in his regular updates to the community. They do Facebook Live videos. He's often said, hey, we're confident the hospital can handle the caseload. Let's work together as a community. What I think is a very optimistic tone. I think I saw a shift in that tone last month in one video, and that was when they were seeing these triple-digit case numbers at the hospital. And of course, he's still telling people you need to mask up, you need to stay home during the holidays, but it was a lot more dire. He warned people that, if you don't stay home, if you don't follow social distancing, if you don't wear your mask, you're going to be killing someone. And he mentioned how he was in the emergency room one night when this was really bad last month. And 44 people in the emergency room were there just waiting for beds. There weren't beds at that time. And so the El Centro Hospital, like I said, they've regularly communicated with the public. They did a Facebook Live video this morning, for example. A worker at the hospital, her parents had contracted the virus, and they were discussing on this video how they underwent treatment at a new antibody infusion center. So in that way, I think with these updates, you really do see these workers as people in your community who are dealing with this on a daily basis.
And before we wrap up, anything iNewsSource is working on the days ahead related to COVID-19 here or in Imperial County?
Yeah, we're going to keep covering Imperial County as it continues to grapple with the pandemic. And we're going to keep digging here in San Diego as well. My colleague, Jill Castellano, she just published a report today about new federal data that shows how troublesome our COVID situation is here in San Diego. So both Imperial County and San Diego counties, they're hard hit regions right now, and our family and our friends and our neighbors, they live there, they're being impacted. And especially during COVID-19, I think these people deserve, the accountability and investigative journalism that we at iNewsSource proudly bring to the table.
Well, we all certainly hope for better days ahead for everybody. I've been speaking with iNewsSource reporter Jennifer Bowman. Thanks, Jennifer.
Thank you.
That wraps up another week of top stories on the KPBS Roundtable. I'd like to thank my guests, Michael Smollins and Jonathan Woson of the San Diego Union Tribune and Jennifer Bowman of iNewsSource. You can find links to all the stories we discussed on our website, kpbs.org. I'm Mark Sauer. Thanks for listening, and join us again next week on the Roundtable.